Hello, everyone, and thank you for joining us in the panel discussion on the role of the private health sector in COVID-19 response, which is actually a part of the RC68 marketplace event. My name is Hassan Salah. I'm the primary healthcare regional advisor and the team lead for access to health service in WHO EMRO. Our agenda will start with a brief presentation on the topic of the panel discussion, and then we'll follow with questions and answers to our colleagues from WHO country office in Afghanistan, Iraq, Palestine, and Pakistan, and of course our colleague from USAID. I would like first to welcome and introduce the panel member alphabetically, Dr. Amir Bibani, National Professional Officer, Iraq WHO country office. Dr. Amir, you can raise your hand so everybody can recognize you. Dr. Ali Shirazi, Coordinator and the Team Lead for the Health System Development, WHO, Pakistan. Ms. Monica Villanova, Acting Social Service Team Lead for the Middle East Bureau, Technical Support, United Agency for the International Development. Dr. Monia Abul Hawa, National Professional Officer for Palestine Country Office. And last but not least, our colleague, Dr. Safi Najibullah, Program Manager, Health System Development, Afghanistan, WHO Country Office. Let us start first with a presentation from Dr. Aya Thabit on the study overview, scope, and the methodology. Dr. Aya is the WHO focal person for the private health sector. Over to you, Dr. Aya.
Thank you, Dr. Hassan, for the introduction. I'll be sharing my screen now.
Yes, please go on.
Please let me know when you can see.
Yes, we can recognize it now. Yes, it's very clear. Thank you very much, Aya. Yes.
Thank you. So my presentation will be divided into two parts. The first part is a quick introduction. Then I'll be giving a quick overview about the panel discussion objectives. So for the introduction, first I'd like to start off by defining what we mean by the private health sector. The private health sector in general includes all non-state entities, individuals, and organizations whose primary purpose is to promote, restore, or maintain health. In the context of service provision, the private health sector includes individuals and organizations that are neither owned nor directly controlled by the government, which are involved in the provision of health services. It can be classified into for-profit, not-for-profit, formal and informal, as well as domestic and international. The private health sector is exceptionally significant in the Eastern Mediterranean region. In a recent assessment, the for-profit private health sector has been estimated to be sought for the provision of 53% of inpatient services and 66% of outpatient services in the EMR. The private health sector is thus considered to be a major stakeholder in the response to COVID-19 pandemic. Accordingly, the Eastern Mediterranean Regional Office conducted an assessment of the role of the private health sector in the response to COVID-19 in 10 EMR countries with the objectives of exploring the level of involvement of the private health sector in planning, coordination, and leadership, surveillance, contact tracing and diagnosis, resource mobilization and financial arrangements, supplies and logistics, case management and referral, as well as risk communication and community engagement. In the study methodology involved two sequential phases. In phase 1, we conducted a desk review, while in phase 2, we conducted a targeted expert interviews to be able to address the identified information gaps in phase 1. On the right-hand side, there's a list of the countries included within the scope of our assessment. So moving to the panel discussion, our objective of the panel discussion is to discuss the key assessment findings in Afghanistan, Iraq, Pakistan, and the occupied Palestinian territories. Over to you, Dr. Hassan, for moderation.
Thanks a lot, Aya. Thank you very much for this overview. Okay, let us start the panel discussion, and we'll start with Pakistan, our colleague, Dr. Ali. In brief, can you kindly please share the key highlights from the country study on potential role of the private health sector as a response to COVID-19? Over to you, Dr. Ali, please.
Thank you. Thank you very much, Dr. Hassan and colleagues for organizing this panel. It's a very important panel, role of private sector in COVID-19 for all of us. And thank you very much for the good question. So the study that you're referring to basically acknowledged, first of all, the role of government of Pakistan and how they basically they involved the private sector from the beginning, at least on the operational level. And one thing good that came, and it was also highlighted in the report, was the resource management system that was established from beginning related to supplies, diagnostic, treatment, everything would go to that resource management system so that at any time the government or whoever is responsible can see how much of the supplies or treatment or diagnostics in private sector, in government sector, where area they are. Now, the key findings of the study was basically in different sectors, in diagnostic and surveillance, first of all, in the vaccine, in the treatment, and then there are few other areas that I will highlight. In terms of diagnostic and surveillance, government of Pakistan ensured that there is unified set of standards, which is national testing and quality standards that is used both by public and private sectors. So this was the first thing that highlighted in the report. The second thing was that the private sector had to report daily the tests to the district and provincial health authorities. So whatever the test results of the people are positive, negative, so they could have the trend basically on time, and every day it would be compiled. So the government also contracted private sector laboratories. I believe that around 50% of the laboratories that could do the COVID testing in Pakistan, around 170 of them, are from the private sector. So it was critical to involve them in this whole area of testing. So that is one area, diagnostic. The other area that private sector played a part was the vaccine. In the beginning, the private sector imported some vaccines, but later on, actually government prohibited them because of some pricing issues. So this is one area that we can look into further for the future. Then the other area is that the government vaccinated all of the health workers, regardless of whether they're from private sector or public sector. So that was one area that was important. So the private sector also, health workers were all vaccinated. The government engaged them in establishing the COVID-19 centers, vaccination centers, so that people could go to that private sector even centers, get vaccinated free of charge. The government would later on reimburse the private sector, and the government also would provide the logistics, supplies, vaccines to the private sector. In terms of the third area, which is therapeutic, from the beginning, government allocated some beds in government, but also some in the private sectors, both in wards and in the ICUs for the COVID-19 patients. So out of 25,000 roughly beds allocated to them, around 4,200, I think, around something around that was in private sector. Again, similarly, 1,600 ventilators were supposed to be reserved for the COVID-19 patients, and out of that, around 350 was in private sector. So in all areas, basically on the diagnostic, on the vaccination, and on the therapeutics, private sector played a key role. Now, there are two other areas I briefly highlight. One is the community outreach for risk management. It is amazing in Pakistan, they have this rural support program network, which includes around 1 million people, most of them volunteers. Around 70,000 community institutions in 126 districts of the country are there. They were engaged, part of them are from private sector, part of the government, and part is the NGO. So it's a mix of everything. And this semi-autonomous organization was involved from the beginning on the campaigns, on the risk communication, on awareness, on health promotion related to COVID. So that is one strong area that was used. In terms of training also, the government developed from the beginning an online training course called We Care, and that was open for both public and private sector workers. From in the first months, even around 100,000 health workers from both public and private were trained through that program. Now, these were all good things mostly, but the study also highlighted some challenges on the involvement of private sector, and I want to highlight the most two important ones. One is the lack of a formal mechanism, so there was no formal mechanism to engage the private sector in the strategic level, in the policy level and national planning So basically what I mentioned was all in operational level, but in the strategic and planning level, there were not that much involved. So this is one shortcoming. And the second was that the weak capacity of the government to regulate the private sector. So the regulatory bodies have to enhance their role there. I will stop there to give the floor to other colleagues. Thank you.
Thanks a lot, Dr. Ali. Really very good brief about the study for Pakistan. Really appreciate it. Let us move to Palestine, and actually from the day one of the pandemic, Ministry of Health coordinate heavily with the private health sector there. My question to Dr. Monia, how did the government ensure the private health sector engaged in the planning, leadership, and the coordination process for the COVID-19 response? Over to you, Dr. Monia.
Thank you, Dr. Hassan. Actually, like you rightly said, the involvement of the private sector and the NGOs in Palestine is something which is really to be commended, and it has taken place since the onset of the crisis. And it actually helped the government to respond better in a good way to the needs of the community. So since the onset of the crisis, the government the private health sector and the non-governmental organizations have been represented in the National Epidemics Committee. Now, this committee was formed to provide scientific guidance on COVID-19 and also to provide some advice on the control measures. The National Epidemics Committee did include representatives from 3 main medical universities who are national, representatives from 2 private hospitals, and also representatives from 3 main non-governmental organizations working in the health sector. The good thing also which happened is that the government actually collaborated with the private health sector and the non-governmental organizations in the update of the case management protocol, which is the main guiding document on the treatment of COVID-19 patients. Additionally, when the government considered passing policy decisions, it has also created what is referred to as the National Health Committee. And while establishing the National Health Committee, the private health sector was included in that. And the task of the National Health Committee is to pass policy decisions to the National Emergency Committee. And this one is chaired by the Prime Minister. So we can see that the main decisions which were made included actually and involved the private sector and the non-governmental organizations. To give you an example, the National Health Committee was composed from the government, it was composed from the main non-governmental organizations, from UN agencies, and also from representatives from the medical, nursing, and paramedical field. In addition, in Palestine, we have a long-standing forum called the Policy Forum. And this Policy Forum actually is composed from 25 health experts within the Palestinian sector. And these ones actually come from different areas that are related to the health and are also part of the health sector, also politicians sometimes with health background. And this representation makes it quite unique. During the process of the COVID-19 response, the government did consult with the Policy Forum and did take their advice and recommendations into consideration while taking other higher policy decisions. One main area which was also important for the involvement of the private sector and the non-governmental organizations is actually as related to research. As we know, COVID did have an impact on many areas that are within the public health and non-public health domain. So actually, the non-governmental organizations and the private health sector did conduct various policy papers and research, such as that related to adolescent health, such as that related to gender-based violence. So we can see that their contribution has been key, and the main success factor was actually their involvement since the onset of the crisis with the government.
Great. Thank you very much, Monia, actually, for this brief. Thanks a lot. Let us, colleague, move to Afghanistan, in which actually from the day one, the not-for-profit play actually a major role there. And my question to Dr. Safi, please elaborate on the role of the for-profit versus the not-for-profit providers.
I think initially I should provide some information on the structure of the health system. In Afghanistan, in 31 out of 34 provinces, health services are contracted out to NGOs, and all the two packages, basic package of essential health services and hospital package, essential package of hospital services are provided by NGOs. So since the beginning of COVID-19 pandemic, some additional tasks, additional contract were awarded to those NGOs, and these included the expansion of bed capacity, establishment of isolation ward, establishment of isolation ward, temporary isolation ward for mild and moderate cases across the country, and also construction of new hospitals. All these were contracted out to NGOs in all provinces, including Kabul. And mainly these initiatives were financed by the World Bank and the Asian Development Bank. At the initial phase, the government did not allow the private sector for-profit to play any role in COVID-19 response. However, with the changes in the leadership of government at a later stage, private sector for-profit was allowed to contribute to the COVID-19 response. And these contribution included inclusion of their expert in different task force to develop and coordinate the activities, and also the guidelines adapted to the context of Afghanistan. In addition of that, diagnosis of lab were allowed to diagnose COVID-19 cases in the private sector, and that played critical role, particularly with thousands of travelers did their PCR tests in the private sector. In addition of that, for case management, private sector for-profit play a critical role, particularly in the second and third wave, when the bed occupancy rate in the public hospitals were more than 100%. In addition of that, private facilities played a major role in overall in case management, in diagnosis, and in coordination and planning, and they were capable to establish a synergy between the public and private sector. And gradually, private sector, particularly the non-for-profit, was already part of the government or part of the government structure, while the non-for-profit, the for-profit emerged as a critical partner of the public sector for responding to the COVID-19 pandemic across the country. I stop here, and then I will talk about the way forward, and that will be linked with the recent development. Over.
Thanks a lot, Dr. Safi. Thank you very much. Let us move to the challenges facing the engagement with private health sector. And my question to Ms. Monica, what are the major challenges facing the countries for successful engagement with private health sector, of course, during the COVID-19? Over to you, Ms. Monica.
Thank you, Dr. Hassan, and good morning or afternoon, all colleagues. So I think overall, the overarching comment would here, but that the relationships between the public and private sectors are really not institutionalized or at a very infancy state in their development. I think we've heard quite a bit about Pakistan, and I think they're sort of one of the outliers that really has been building a private-public relationship with the government, but many other countries have just started those discussions, and so very infant stages. Very few have a permanent structure focused on the private-public relationship, and so that was really evident in the response, and I'll talk about this in a couple of minutes. One of the challenges you also have to consider is the bandwidth of the ministries of health, right? So when we were at the heydays of the pandemic, and we still are, the high demand and attention that the Ministry of Health, it really limits their bandwidth to think, I think, strategically about engagement with the private health sector. The private health sector, one of the other challenges is just it's unsure how to really include them in the planning and in the response of the COVID-19 for various countries. This was evident in Iraq, in Jordan, and Lebanon. In some instances, the private health sector was eager to support, but really there was no guidance or a pre-existing collaboration framework. And this was really exacerbated by the constantly changing approaches to the pandemic and that limited the impact. So, at the onset of the pandemic, the focus was really on how do we have access to PPE. In the private sector, I think the rhythm over time changed, and the private sector really was, I think the public sector was really able to leverage the private health sector in this way. But then, now we've shifted towards vaccines. And so again, it's really reconstituted that relationship, and what does it mean to really leverage those platforms. While the report didn't include Morocco, we also saw this trend there where there was an initial reticence to really work with the private health sector, also in the absence of, a collaboration framework. But eventually, many of these countries turned towards, especially when you saw high cases or a high demand for secondary and tertiary support, you really saw many countries pivot towards using the private health sector. And in some of these cases, it really improved the government's responsiveness and the effectiveness of the response. Another challenge would be the lack of data in country specifically data on the private health sector. And so in the absence of data, it really, I think prevented a lot of challenges in terms of how do we best utilize the private health sector. So for example, in Tunisia, there was limited data to optimize the use of secondary and tertiary health services there, especially on case management and treatment. Egypt was also similar in that regard. Another challenge was that the private health sector is not integrated into the public health sector, the public health sector's health system strengthening approach. And so an example here would be on training, on our policy updates. When the surge came last year, when many countries experienced sort of questions around how do we train up our workforce, what kind of policies do we put in place, how do we update our protocols, the private health sector was usually the last to really receive the training or to have access to change protocols. So that was another challenge. And then finally, and many of our colleagues here indicated to this, especially, our colleagues in Pakistan, is the weak systems and regulation limits the private sector role. So for example, again, in Iraq, the private health sector was prohibited from providing services due to failures to comply with infection prevention control. So, in that instance, you saw a delay of use of the private health sector for 3 weeks while the private health sector was able to comply. So again, it's really, I think looking forward, and we can talk about this later, is how do we institutionalize these relationships, and how do you build a strong collaborative framework? So I'll stop there. Thank you.
Thanks a lot, Ms. Monica. It's really very good brief about the whole challenges from the regional perspective things. Thank you very much. Again, about the challenges, and my question to Dr. Amir from Iraq. In your opinion, what are the factors that limit the presence of effective role of the private health sector in the public health emergency? Over to you, Dr. Amir, please.
Yeah, thank you, Dr. Hassan. To answer your question, I would like just to highlight how Iraq is you can see in Iraq a fast-growing and expanding private sector that provides care at different levels. Like, I mean, imagine like we have more than 10,000 clinics and then over 200 hospitals, different specialties. And figures tells you that about 51% of people are having, paying out-of-pocket expenditure percentage is 51%. So you can imagine how effective they can be utilized in partnership with the private health sector. I mean, the national health policy for Iraq clearly defines public-private partnership and focuses on strengthening the partnership with the private sector. But with that, during the first onset of the pandemic, we have seen they were clearly the government dependent on the public sector to provide services, and they were prohibited from providing any case detection or management. But then as the pandemic went on, the regulations changed and they were allowed to participate. So in my opinion, to respond to your question, there are several factors, together limiting the effective private sector engagement in emergencies in Iraq. These includes legal aspects, dual practice, and poor funding mechanisms. The government clearly determined to take the full responsibility to control the emergencies, as I stated during the first onset of the pandemic. These are based on the Iraqi public health law that was issued about 40 years ago. I know there are efforts to review and revise this law, which is currently in the Parliament of Iraq to be endorsed. This is a great steps. Saying that, we need all the available resources, the public health, to be used for the interest of public health priorities in Iraq. Therefore, I think the private sector contribution was greatly shaped by the currently acting factors, which allow only donation to be main available contribution related to emergency response. And we've seen that, private sector were eager, at the onset of the pandemic to come up to the ministry and donate PPEs and donate space to Iraqi Ministry of Health. And also they had other contributions related to reducing fees on patients and providing human resources, making them available to the government. Over to you, Dr. Hassan.
Thanks a lot, Dr. Amir. Thank you very much. I really appreciate your brief about the situation there. Let us go back again to Palestine and Dr. Monia. What was the role of the private health sector in promoting communication and community engagement during the COVID-19 pandemic in Palestine? Over to you, Dr. Monia, please.
Thank you, Dr. Hassan. Again, when it comes to Palestine and the role of the non-governmental organizations and the private sector, it is complementary to the role played by the government. In Palestine, historically, the non-governmental organizations and the private sector did play a huge role when it comes to the community engagement. For people who are familiar with Palestine, you would know that we are really challenged by the geopolitical situation. We are really challenged by the political restrictions and also by the physical restrictions of the closures of the checkpoints and also of the division of the areas after the Oslo Accords took place. So the role played by the private sector and the NGOs is actually historic, and they have actually do have a proven track record in implementing activities that have to do with the community engagement and also in promoting risk communication. The thing is that during the response to COVID-19, what they have done has been complementary also and in guidance with the Ministry of Health. So while the ministry, since the onset of the crisis, have actually led the process of promoting risk communication and community engagement, the NGOs have actually focused again on the areas which are underprivileged and under-marginalized. And to do that, they have actually utilized what they already know from their experience on the ground. For instance, they have actually promoted providing counseling at the primary healthcare centers and mobile clinics. They promoted the key World Health Organization and Ministry of Health messages. They have deployed their community health workers to households, basically who are in remote areas, especially for people who are at high risk, such as lactating women, people with disability, people who are old, or any other group who is at risk, to provide them with the necessary counseling, and at certain times to provide them with the required services. They have also deployed their volunteers to help in sanitizing public facilities. And at certain points when people are at quarantine, they would actually move those volunteers to provide the necessary food, non-food items, and at certain times, medications in collaboration with the Ministry of Health. In addition, the NGOs and the private sector do have an experience in forming youth groups. And they have utilized forming youth groups actually to help other youth when it comes to psychosocial services, because we all know the impact of COVID-19 on the psychosocial aspects for the human beings, especially for the children and also for the elderly. So to wrap it all up, they did have a good and a successful role in the promotion of risk communication and also with the community engagement. Their role was actually very complementary and had proven to provide services to the underprivileged and to the marginalized people.
Thanks a lot. Thank you very much, Dr. Munia. Now, my last question, and it is actually directed to our colleagues from Afghanistan, Iraq, and Pakistan, about their view for the future engagement with the private health sector. Let us first start with Dr. Safi from Afghanistan. Over to you, Dr. Safi, please.
Thanks, Dr. Hassan. With recent political changes in Afghanistan, I will say with recent dramatic political changes in Afghanistan, I think the role of government, state, and also the role of private sector, it is emerging and it will be redefined gradually over the coming months. With the new restriction on funding to Afghanistan by different bilateral donors, including World Bank, I believe that the role of private sector, non-for-profit private sector NGOs will gradually reduce until they find new mechanism for financing, while at the same time the role of private sector for-profit will increase as government has limited capacity and budget available to provide services to the public. As before, as private sector played a critical role in raising awareness through one-to-one communication with patient and also through different IC campaigns, through mass media, TV, radios, through billboards across the cities. They played a critical role in raising public awareness. In addition of that, some of the private sector beyond the health sector, private media, TVs, radios, some suppliers, they played a role in raising public awareness while linking their product with different messages of COVID-19. So at the same time, they were doing two things, promoting their product and also product and services, and also raising awareness on COVID-19. In addition of these, I think private sector will continue to play a more significant role in case management and also in diagnosis of patient. But still, we are in the initial phase of political transformation. So we will see how things are evolving over the coming weeks and months, and that will guide the role of private sector and also the role of public sector, not only in COVID-19 response, but also in overall provision of health services. I stop here.
Thanks a lot. Thank you very much, Dr. Safi. Dr. Amir from Iraq, how is your view for the future engagement and the opportunities? Over to you, sir.
Thank you, Dr. Hassan. I mean, based on the lesson learned from COVID-19 combat in Iraq, I mean, I would definitely say the only way forward is and the best practice is responding to health emergencies, is to collaborate and with the private sector, with any entities that providing health care during emergencies. I mean, based on this conclusion, I would invite the Ministry of Health to endorse and activate the public-private partnership response in emergencies. I mean, definitely this would be based on and agreed on basic principles that these principles are that make sure that the health, the service provided, all the efforts are unified within the country for public and private, definitely based on evidence-based best practice preparedness and response to emergencies plans, and at the same time approving regulation that permit effective engagement of private sector in diagnosis or in treatment or in prevention during such emergencies, and also engaging effective health sector specialists in planning and response during the planning and preparedness and plan to respond to COVID. Thank you, Dr. Hassan.
Thank you, sir. Dr. Ali from Pakistan, over to you, sir. How do you see the future engagement with private sector in the region?
Thank you very much. Hopefully right, hopefully. We always hope for the best. So basically the COVID-19 response, I think, created opportunities for Pakistan as for other countries to further engage with private sectors. The study that was mentioned, I think, highlighted challenges there and also opportunities where we have to strengthen. So we will root, the way forward, hopefully, also in the findings of the study, not to just shape it. So I want to I highlighted before the engagement with private sector, how it was beneficial to a large extent, not only in testing, but also in vaccination and on treatment of the COVID-19 patients. We will try to strengthen it going forward. Further to that, I want to highlight that WHO established this advisory committee with the help of both public and private sectors from the initial phases of COVID-19. That will, be there, and for any other future emergencies can also be basis. WHO provided support to private sector, actually university, for genomic surveillance of COVID-19. So that will be again there for the for new variants and all that. That will be there. We will try to strengthen that in Pakistan, but also it will remain as a capacity for the future. So the other thing is that the private sector, we have to understand that the private sector is playing a critical role in Pakistan and shall be engaged in all health-related initiatives because it caters to most of the needs of the population, particularly in the service delivery for curative services. One area that I mentioned is a challenge, and it was mentioned by other colleagues, is the regulatory strengthening. That is also a challenge in Pakistan. We mentioned, for example, the hurdles on importing of vaccine by private sector, but also other things. So the regulatory strengthening is an issue that we will look forward to work with the government on that. Finally, I want to say that highlight that WHO is working with the government right now to expand the UHC benefit package to all of the provinces to the country. Now we have some pilot provinces, particularly on the PHC level and insurance program. So these are all areas that we will engage. We will try to engage and have this public-private partnership with the private sectors on the insurance, on providing of the services based on this package of comprehensive package to hopefully go towards the UHC. As I said, private sector has a critical role in this UHC benefit package in all of our countries, and I think we have to engage more and more. Thank you. I stop.
Thank you, Dr. Ali. Thank you very much. Before we move to the closing remarks, any other notes, comments from you colleagues? Ms. Monica, Dr. Monia, any more comments, feedback? Great. Great.
I will just add one point from
Afghanistan.
Yes, please. One area where private sector will play a greater role in coming weeks and months, that is immunization, COVID vaccination. With restriction on NGOs that are providing services, I think that will be gradually shifted to private sector, and they will play a critical role in expanding the coverage of COVID-19 vaccination. Over.
Very good, very important notes. Yes, we need actually to have a separate discussion about this, but thank you, Dr. Safi. Thank you very much for this. Okay, so let us move. Thanks again for the very good panel discussion, and let us move to the couple of remarks as a closing remarks for our panel. In the early stage of the pandemic, and this is back to March last year of the 2020, a number of countries actually in governments in our region, they announced that the COVID-19 patient is full responsibility of the public and the government sector only. And this was in mid-March, maybe late March last year. And then a couple of months after that, and because these countries actually was in need to increase their capacity for the service delivery, they allowed the private sector to go for the test and to diagnose and for the treatment as well of the COVID-19 patient. This actually tells us how really the private health sector has a major role in COVID-19 response. My take-home message from our panel today that the engagement with private health sector must continue beyond the COVID-19 through building good and successful models to reach to the universal health coverage and health security. Thank you, colleagues. Thank you very much, and goodbye.